For many new moms, obtaining a pre-pregnancy body shape is not easy. Diet and exercise alone do not always do the trick.
Dr. Joshua Kreithen of Holcomb Kreithen Plastic Surgery and Med Spa is with us now with some other options. And I love what you're calling this because I think a lot of women will really key into this. You do what's called a mommy makeover procedure. So what's included with that?
Yes, well, I'm a board-certified plastic and reconstructive surgeon, and one of my areas of expertise is with doing this procedure called the mommy makeover. And usually it's a combination of operations which include the abdomen, the breasts, and sometimes liposuction to help a woman after pregnancy, after she's done having all her kids, really to restore her body to pre-pregnancy shape.
What exactly is a tummy tuck?
So a tummy tuck is an operation that removes the extra skin of the lower abdomen. So after a woman delivers a child, there's a stretching of the skin, there's a stretching of the muscles, and so what that operation does is it restores a nice flat tummy by sewing the muscles back together, removing the extra skin.
Well, again, the pictures really tell the story here, so let's take a look at a couple of befores and afters. So this is the tummy tuck.
Correct. So this photo shows a woman who's had, after pregnancy, some loose, stretched out skin of her lower abdomen. And this operation, it takes about 3 hours. And what I do is I remove that extra skin, sew up everything real nice and tight, including the muscles. So here she is in her after picture about 3 months later, and recovery time takes about a month. And she has a nice flat tummy. She's very happy.
How long are we talking, doctor, after having a child? Do you typically get these kinds of procedures? What's a safe amount of time?
I'd say on average 3 to 6 months after a woman is done breastfeeding. And I recommend to all pregnant moms out there to breastfeed their children. It's the healthiest thing. So typically it takes 3 to 6 months for her body to heal and then be ready for an operation safely.
Let's take a look at another before and after. And what have you done here?
So here's one of my patients. She'd had 3 children. Her muscles are really stretched out. It's called a diastasis. And also she has some breast issues. Some of it is blocked out with that black bar. Obviously we can't show some of these pictures on TV. However, she has some drooping of the breast and loss of volume. So here in this mommy makeover procedure, I've done a breast augmentation with a lift and then the tummy tuck procedure, as well as some liposuction on her backside. And I think there's a second picture to show there to give her a more contoured shape.
Wow, that's pretty dramatic.
So it's a big transformation.
Very dramatic.
This is a 6-hour surgery, and I just love helping my patients, particularly my female patients, get their bodies back in shape after delivering children.
For the non-mommies who are watching right now, what other types of body contouring procedures do you have?
Well, a lot of procedures, and I focus on breast and body. I do breast augmentation, breast lift. Also, I have a lot of breast cancer patients. I do breast reconstruction, breast reduction for women who are too large. I do a lot of liposuction procedures. And so a lot of the skills that I have and what I'm passionate about is helping those patients sculpt their bodies so that they can feel as good as possible.
And real quick, how does a patient maintain those results once you get them? Because there is work involved.
Sure, that's a great question. Certainly 50% is on me, and then after the procedure, 50% is on my patient. They need to choose good lifestyle habits afterwards in terms of eating the right things, clean, healthy eating, as well as maintaining some cardiovascular exercise.
Okay, so schedule your consultation at Holcomb Kreithen Plastic Surgery today by going to sarasota-med.com or tampa-med.com.
All right, Dr. Kreithen,
Thank you.
Thanks.
Thank you so much.